Hello and welcome to my channel. This is the first one of a series of presentations to cover the 4 performance domains for alcohol and drug counselors. This is a brief summary to help you study for the alcohol and drug counselor exam by the IC&RC with the new changes for the updated version that started in February of this year. Performance domain number 1 covers the screening, assessment, and engagement processes. There are different tasks involved in this performance domain. We have 8 tasks, which is to demonstrate verbal and nonverbal communication, to establish rapport and promote engagement, discuss with the client the purpose and procedures associated with the screening process to help the client understand this process and to facilitate the client's cooperation. Assess the client's immediate needs and evaluate the behavior and other relevant information, including the signs and symptoms of intoxication or withdrawal. Administer appropriate evidence-based screening and assessment instruments specific to clients to determine the strengths and needs. We also want to obtain relevant history and related information to determine the eligibility and appropriateness of services and make good referrals. We also want to screen for physical needs, medical conditions, and co-occurring mental health disorders that might require additional assessment and referrals. We want to be able to interpret the results of the screening and assessment and integrate all available information to formulate a diagnostic impression and to be able to create a treatment plan. We also want to develop a written summary of the results of the screening and the assessment and to document all this information that can help us come up with treatment recommendations. The screening and assessment processes are part of the clinical evaluation, which is a systematic approach that helps us recognize and diagnose substance abuse problems and co-occurring mental disorders. We'll talk about the screening process first. We use a screening to distinguish people who might have a disorder from those who do not have one. And it helps us review the client's current situation by gathering information. We decide if the client is eligible for admissions into a particular agency, for example, the one that we are working at. And if it's not, if our client is not eligible for our agency, then we can make a referral to other services in the community. We consider the client's needs and characteristics. We explore the available resources in the community. And then from the screening, we choose the best course of action. How do we do a screening? We gather data using different screening instruments. This list here is not a comprehensive list. There are many screening instruments, and I will go into more detail about these in another presentation, but this is just an example. You have the Alcohol Use Disorders Identification Test. You have the CAGE questionnaire, the Drug Abuse Screening Test, the Michigan Alcoholism Screening Test, and so on. How do we select the right screening tool? We must select the tool that is sensitive to the age, developmental level, culture, and gender of our client. What kind of information are we gathering? The data, the information we gather should include a general overview of the current and past history of substance abuse, substance use or addiction, the types of treatment received, physical and mental health, and the current socioeconomic and environmental problems. The screening is the first interaction between the client and the counselor. One of our main goals is to build rapport with the client. The competencies needed for this function are to demonstrate effective verbal and nonverbal communication, remember the uniqueness of each client, and understand the difference between use, abuse, dependence, and addiction, know how to administer and score screening instruments, identify validated screening instruments for substance abuse and mental status, be familiar with symptoms of intoxication, withdrawal, and toxicity for all substances, alone and in combination with others. Know what a crisis is and how to prevent one. Remember that a competency is the ability to do something successfully and efficiently, and the certification exam for alcohol and drug counselors measures the competencies in these 4 practice domains. Motivational interviewing is a very useful tool during the screening process. It is very effective at assessing the client's readiness to address substance abuse issues. It is a non-confrontational technique. It rolls with resistance and denial, and it exposes the client's perception of the problem, and it measures his or her stage of change. This is the end of the presentation for the screening. In the next topic, I will be talking about assessment, which is still part of the performance domain number 1. Thank you very much for watching. Don't forget to subscribe and follow me at lcdcexamreview.com for more information and other recommended resources to prepare for the certification exam by the IC&RC for alcohol and drug counselors. Leave me your comments or questions if you want me to make a presentation about a specific topic, and thank you very much.